We are now into the afternoon program, and we have two sessions. And the first is with Kay Knox and Sharon Silver. I'm going to use the current name, okay, despite the security name, from Within Reach. And Kay Knox is the CEO of Within Reach and has played a key role in the organization's growth and expansion over the past 24 years. Her passion, leadership, and impact have been inspired by her close work with Cynthia Shurtleff, the founding mother of Within Reach. Sharon is the Chief Strategy Officer at Within Reach. She's worked over 20 years in helping transform urban childhood and social service systems in Washington, ensuring easier access and improved support for families. She's a foundational leader in the development of the Help Me Grow Washington Network and leads Within Reach policy advocacy efforts.
As Bill said, I am Kay Knox, the CEO of Within Reach, and you'll be hearing from Sharon later in this presentation. But we're very grateful to be here. I want to thank Sterling and Bill and others who have made this event possible and have chosen to include us. So thank you so much. So we're going to talk about a couple of different things today. I'm going to begin by talking a little bit about Cynthia Shurtleff's legacy of advocacy and action through Within Reach. And probably a number of you know this history, but it's really incredibly important to us. And Cynthia's passion and leadership lives in every single thing we do every day. So as you heard Bill mention, we refer to Cynthia as the founding mother of Within Reach, which originally was Healthy Mothers, Healthy Babies Coalition of Washington. She really, truly was the visionary, the activator, the heart, the advocate, the inspiration behind all of what this organization has become. And at Within Reach, we believe that all families deserve to be healthy. Back in the mid-'80s, Cynthia, along with a few other people, recognized a really unique opportunity to better the health of pregnant women and children right on the heels of the Maternity Care Access Act. And so that's what caused them to start the Healthy Mothers, Healthy Babies Coalition of Washington. They attended a national Healthy Mothers, Healthy Babies event, and Cynthia came back to Washington and said, we need this. We need this here. We need to develop it. It's time to get moving. And so that birthed the first call center, or that Healthy Mothers, Healthy Babies hosted, which was a way for women to learn about pregnancy Medicaid, essentially. And then I think you can see in the picture at the bottom there, you see Ginny English, Mona Lee Locke, Nancy Cherry, board members, and Cynthia. And Cynthia and Mona Lee Locke are holding a baby book, which became a really critical device, mechanism for getting women connected to pregnancy health care, which was really lacking in the state at that time across the country. And that book went on to be translated into, 7, 8 languages, something like that, and was a huge resource. And I really appreciated your comments about Cynthia being at the forefront, walking through those halls of the legislature, and then, making a path for you to move forward. Well, you'll see in all these pictures, Cynthia is right there standing alongside all the people that she vaulted forward in this work. So along the way, our work increased in both scope, depth, and breadth. And through that work, Cynthia was a very, very big part of founding the Immunization Action Coalition of Washington and the Breastfeeding Coalition of Washington, both critical health behaviors, as you all know, for the wellness of moms and babies. Oops.
Sorry.
And I think I can even speak to the slide without the slide. And just say that, as I said from the beginning, Cynthia's mark is in and on everything that we do even today. In addition to helping create this capacity for our state, she really believed in fostering the growth and leadership in others. And so we established the Cynthia F. Shurtleff Leadership Award to recognize individuals who shared even a part of her commitment to families in our state. And she believed in the longevity of our organization. So for over 35 years, we've carried her passion forward, and she worked very, very hard to support the private part of this public-private partnership. And so our major donor circle is named for Cynthia. I think that this picture kind of says it all. This is from an earlier event, within reach event, and you do see Cynthia there at the center. There's not a person on that board that wouldn't have wanted Cynthia to be in the center because she was the center of our work. But you also see Dr. David Shurtleff always there supporting Cynthia's passion, her drive, her work, our ability to create change, and of course David continues to do that in very meaningful ways in our work. So the impact is huge, and I'm going to say just a few things about kind of who we are today. So when Cynthia started that organization, Healthy Mothers, Healthy Babies, we were a 3-person organization. Moving toward the end of this year, I think we will approach 90 staff. And a real breadth and depth of service, unlike any of us could have imagined, really, in those early days. So for those of you who are less familiar with Within Reach, we are a local nonprofit organization with a statewide reach. Our work is to help families navigate our complex health and social service systems and connect them to all the resources they need to be healthy and safe. And we create that impact in a couple of different ways. So working directly one-on-one with families to help identify their needs and to ensure that they have the connection and the ability to, again, navigate the resources they need in their communities. So providing that immediate support. And then the other way that we do that is over years and years of doing this work, recognizing that we can work with individuals, we can make a big impact. Those folks are navigating systems that are challenging, are siloed, are many things. And so we have also worked and continue to work in systems transformation. So building partnerships with providers, community-based organizations, policymakers to improve the whole system. So going upstream to try to make that easier so families can find the right help with a lot greater ease. And I like to say, I think Within Reach is unique in that it does work at that intersection of immediate need and lasting impact. So we're trying to kind of create change both places. And this work is carried out with the staff that I think, again, carry on all of the things that Cynthia taught us, and that was basing our work and our care for families in values of inclusion, collaboration, agility, innovation, quality. These are the things that drive our staff forward in our work. So next you're going to have the opportunity to hear from Sharon, but before you jump in here, I just want to say that I have let the board of directors know that after 24 years at the organization, I am ready to transition out of my role as CEO, and I feel content and complete in my leadership, but even more so, I feel so confident in this organization and its leadership moving forward. And so it is a huge pleasure to introduce you to Sharon, who is our Chief Strategy Officer, but will also be stepping into the role of interim CEO. And there are very few strategic thinkers, I think, and strategists working towards improving the health of families like Sharon, very much like Cynthia, driven to find a better way to do this for families. So I'm really excited that you get to hear Sharon talk about one of these major transformations for our state that we've been fortunate enough to play a role in. So I'm going to turn it over to you, Sharon. Yeah, I think so. Makes it.
Okay. So hello, everyone. Wrong one. that way.
That's there, you go. Sorry.
Yes, that's okay. I am Sharon Silver, as Kay introed me. I want to share about Help Me Grow Washington with you all. But before I do that, I want to say I really appreciated being able to be here for your comments, Emily. And I don't have a slide with a picture or any particular pieces about Cynthia, but I do want to share that Kay has described the role that Cynthia played in founding Healthy Mothers, Healthy Babies Now Within Reach. And it is a culture that she created. We call her founding mother because she cared so deeply about moms and children and the staff of the organization that she really did birth. There were 3 people to start. She wanted to make sure everybody that came on board felt welcome. She was around the office for a long time. She would walk in with her boots and her outfit, and she was an amazing force of love and confidence. And I can't tell you how many times I would hear when I would go into professional meetings where anyone knew of Cynthia or knew her personally, and they would share with me that if Cynthia asked for something, she got it. People listened to her. They knew she was thinking in the right direction, and they would listen. And that was huge for our organization and what we've been able to do. So I feel really blessed to be able to be here and share that with you and give you sort of a sense of where we're at now, 35 years into our organization, and Help Me Grow is a part of it. It's a big part of it. And I think many of you have potentially heard about this Help Me Grow system that's being built in Washington. And I'm just going to give you a little bit more concrete detail around what it is. I'm going to start by sharing this slide and step back for a moment and say that it's a national model. So there's two graphics up here. This one on the left-hand side is the national model of Help Me Grow. And on the right is a bit of an adaptation we've made in Washington. And it's a system building model that is essentially built so that families will have easy access to resources, including healthcare, social supports, developmental screening, the whole gamut of support services for young children, ideally. And to do that, there are system components that need to be working together. It was the brainchild, the idea of a doctor named Paul Dworkin out of Connecticut Children's Medical Center. He is a neurodevelopmental pediatrician and was experiencing in his own practice in the hospital setting children, again and again, not having the access, the families not having the access to the support services for those kids in order to support their development into and beyond the early development stage of their life. And so he created the system. It launched in Hartford, Connecticut in 1997. It was super effective. And so they took it to the whole Connecticut state level. Connecticut is a small state. And so ultimately, from there, with the success that it had, they decided with support from the Kellogg Foundation to replicate this model across the country. It was first replicated in Orange County, California, 2003, I believe, and was successful at that county level. And then they started looking for states to see if they could replicate at the state level. So the model components that all of the states and counties that are now using the model for coordination and system building are a centralized access point, which is really the heart of it. It's the place where families can call and reach out to get connections to services. It involves child health provider outreach, family outreach, and data collection and analysis. So those are big 4 components that work together. There's a lot of detail within what it is that happens in each one of those core components. I have a little more on that to share. But for the most part, when it's working together, it's seamless for families. That's the point. And in Washington, We have added equity to the center of ours, because that is really important, as we all know. And it's not that National Help Me Grow doesn't agree, it's that we felt like actually adding it at the center was important for everyone engaged in the system and for the families to understand that's the heart of the work for us. So this is a little bit more about the system components. The child healthcare provider outreach really calls on healthcare providers to champion Help Me Grow, to be involved in referring families to what we call the coordinated access point, which is a telephone line, it's an online resource, it's a number of different ways that families can access us. And it also encourages, and through its work, developmental screening. So I'm guessing that you all know way more about that part than I would even need to advocate for it, but part of the model is to ensure that all families and all kids are being screened. So we collected a lot of data to support evaluation, identify where there are gaps in services for families. We also use it for advocacy. So taking Cynthia's heart and passion of using data and using systems that work, advocating in Olympia, we do that. And it's a core component of the model. And then we really want to make sure families know about this, and that there is a voice for them in the system. We work with families to understand how to improve the system. That's a big part of what we do as well. And we're all working towards equity, so all families are connected to services in a way that meets their needs at that moment in the way they need them met. So I'm not going to read all the little sub-bullets. This is an infographic of our timeline of how we've evolved in Washington with our Help Me Grow work. We launched in 2010. We were essentially a small cohort of the first states to try the Help Me Grow model at a statewide level. We were at Within Reach, we were picked as the state affiliate, which is a big role, and it was a big honor, and it was essentially, we were awarded that because of the family model that we had developed with our telephone access and our screenings and referral systems. The heart of what Cynthia wanted for us to be able to do for families was the model that created the obvious choice of Within Reach to be the Washington State affiliate. We've since done a lot of things in relation to ensuring ASQ and ASQSEs are happening, connecting families to early intervention as needed, helping providers, clinicians to understand that they can help connect families to us so that we can also do wraparound services, and you'll learn more about what those are in a moment. And then essentially we're on a really fast path. This looks a little like, it's a little bit slow over 12 years, but I'll tell you right now, there is so much momentum for this. We've received state legislative funding for the first time in the last session. We're very excited to have lots of new exciting partnerships at the statewide and local level. So there's going to be a lot more happening and a lot more obvious Help Me Grow activity in the state coming soon. So we're very excited to be able to work with you all on that. Okay, I'm going to breeze through this because I want to make sure we have enough time. But Help Me Grow is essentially for all families. There is no income requirement. It does provide the best and most resources for families with young children, but it's not limited to that. There are some resources that are supported for kids of all ages and family members. There's a big focus on state benefit programs like health insurance and food benefit programs. And providers, doctors, clinicians, child care providers, we use provider fairly broad because it can be anyone that works with young children. They can refer to us and to Help Me Grow, and we can do a big heavy lift that the provider doesn't have to do in the visit with the family that relates to those benefits and resources. So here's the way to connect to us, but I'm going to jump to the video, if that would be easy. And then we can come back to, if we want to, like, how do you then refer to Help Me Grow?
Welcome to the Help Me Grow Washington Essential Services video. Help Me Grow Washington is a free service that connects parents and caregivers to resources in their community. There are a lot of resources out there, so Help Me Grow Washington focuses on the ones that support healthy children and healthy families. We call them our Help Me Grow Washington Essential Services. These resources are the set of services and supports that the Help Me Grow Washington network has prioritized and works to ensure all families have access to, regardless of whether they're calling a local Help Me Grow or the statewide hotline. It's important to know Help Me Grow offers different levels of resource support depending on the needs of the caller and the type of resource they're looking for. The first level of support is given to every caller, and we call it information and education. This means that a resource specialist or navigator is sharing with the caller what resources are available that might help them meet their need. This doesn't necessarily mean a referral is being placed. For example, if someone were to call in wanting help with food support, you could share information about food banks in their area, food programs that they might be eligible for, and different community organizations who may be able to help them locally. We could also provide information on things like the Basic Food Benefit Program and walk through the eligibility guidelines. At that point, the caller might feel like they have all the information and education they want, but don't want a referral to any particular resource. If that's the case, we call this an information and an education call. Our other level of support is a referral. Referrals will look different depending on the particular resource Help Me Grow is connecting a caller to. Sometimes a referral means we're providing a caller with contact information, like an address, phone number, or a contact person. Sometimes Help Me Grow is able to directly enroll, apply, or do a screening for a program or service. Let's use health insurance for this example. If a caller was looking to get application assistance, a family resource specialist or navigator could refer them to a local organization that can support enrollment in person. Depending on the Help Me Grow system, the family resource specialist or navigator could potentially enroll them during the call themselves. Each caller is unique in their needs and in what's available locally, so support will be adapted to that. As I mentioned before, there are a lot of resources out there. The 4 categories of the Help Me Grow Washington Essential Services are focused on resources that improve food security, resources that will help a caller get connected to adult and pediatric health care, resources that support family stability, and finally, resources that connect callers and children to child development supports. The rest of this video will cover more of what types of resources and services are included in each of these categories. For each category, I'll share about what local community resources and supports look like, as well as share what resources fit into this category on a statewide level. The first category I'll cover includes resources that focus on food security. Our resource directory primarily reflects these supports and programs shown on your screen here. Help Me Grow can connect you to food banks in your community or share information about summer meal programs. It can also help support enrollment into the Basic Food Program or the Women, Infants, and Children, or WIC program. Our resource specialists and navigators may also have insight into things like pilot programs an organization might be offering that can meet a caller's needs. The next category of resources are focused on getting callers connected to adult and pediatric healthcare. The local community supports and resources are really focused on the places and ways a person can receive healthcare. So things like transportation, clinic locations, and specific services like behavioral health or family planning are all resources that a caller might be educated about. Help Me Grow can also support enrollment in Medicaid, what's called Apple Health in our state, or to qualified subsidized health plans. In Washington, having Apple Health means having dental insurance, so it can also connect callers to regional pediatric dental support or to organizations who keep up-to-date registries of dental providers, like the ABCD program. The next set of resources that Help Me Grow Washington focuses on are those that work towards strengthening a family's basic needs. In this category, we work on keeping our resource directory up to date on services and programs that can help a caller get diapers from a local diaper bank, or connect them to child care supports like Child Care Aware Washington, or a local nursery for emergency needs. The resources in this category may have eligibility requirements, and our resource specialists and navigators can help a caller walk through that information. In Washington State, there are also statewide programs that we can help navigate through with the caller. Help Me Grow Washington is an official community partner with the Washington Paid Family and Medical Leave Program, and some Help Me Grow systems can also support application and enrollment into the Temporary Assistance for Needy Families, or TANF program. The fourth category that Help Me Grow Washington specializes in are resources that focus on child development supports. There are many local community supports available to callers who are interested in their child's development. Callers can learn about local play and learn groups, ways to get a developmental evaluation, and can be connected to services and supports specifically for families with children with disabilities and/or developmental delays. On the statewide level, Help Me Grow Washington also has the ability to support the Ages and Stages Questionnaire, or the ASQ. This is the questionnaire that can help parents and caregivers understand where their child is in their development. The ASQ has questions like, does your child tell you they want something by pointing to it? Or, does your child help turn the pages of a book? These questions are all based on a child's age and the activities that most children are doing at that age. Help Me Grow will send you a questionnaire and then review your results with you and suggest activities or resources. Help Me Grow can also support information and education on or referrals to child development support programs that are available across the state but are locally led, like early support for infants and toddlers, or the Children and Youth Special Healthcare Needs Program. I hope I've been able to give you a better idea of what Help Me Grow Washington can do to support children and their parents and caregivers. If you're interested in learning more, please visit our website at www.helpmegrowwa.org or email us at hmgwa@withinreachwa.org to schedule a presentation. We'll be able to connect you with state-affiliate staff from Within Reach or with your local Help Me Grow system. Thanks for watching, and be sure to check out our Help Me Grow 101 video for more information about how Help Me Grow works.
So that's essentially what Help Me Grow is. And those are the essential services that we'll walk through. All families are offered all of that, more or less, but in a way that essentially allows the family to talk about what their needs are, and then we match those services with their needs. So it's very friendly, it's very warm, it's very different than talking to a government agency, for instance, or sitting on hold for a long time to get through the services. We have very quick access to our staff, which is a priority for us. So there's a hotline for families to call. There's a website, parenthelp123.org, and the Help Me Grow Washington website, which was referenced there in the video. Both are entry points for families and to learn more about what we do. Providers across the state refer to us. So if there is a need in any of the practices that you are aware of to refer families to us, you can do it one of those top two ways, just by sharing the information, or for some providers in the state, we actually have an online form and a portal directly to our staff where they're referring families directly to us, and then we share that information back with the provider about what the work through Help Me Grow was and how they were connected. So that is something we are very excited about doing in partnership with healthcare. So if you know of anyone that's interested in that, please let us know. And then if you are connecting families who want to continue to do free ASQs outside of the well child visits, we have free access. You know, there are a lot of ASQs available, and it's a child development promotion tool that families enjoy. So that is free for families to do through our Help Me Grow and our Parent Help 123 websites. And that is, this is data about Help Me Grow. So not necessarily worth going deep into. This is 2022 highlights. We're really proud of the fact that we are providing multilingual access to families. We essentially we haven't encountered a language that we can't help families through interpreter services with. 75% of the families that we work with fit into the BIPOC category of Black, Indigenous, or person of color. So we're really reaching a lot of families of color. And as I was saying about language, 1 in 4, 25% are non-English speaking families. So we really are reaching hard to reach communities in the state. And as you can see, we have, families across the state reaching out to us when we're working with. So we are really truly a Washington statewide support service. And I am going to just end now and see if there are questions for either me or Kay. We're right at about time, but happy to stay for a few moments or minutes more if there's any of that you would like to talk about.
Sharon, I have a question.
Yes, Sarah.
Unfortunately, we know that children who are BIPOC are more likely to have unmet financial needs, and their parents are more likely to have unmet financial needs. And I wonder how you explain that phenomenal uptake for families who are BIPOC. So beyond the disparate impact of having financial needs, what sort of marketing do you do, or how do you explain this great uptake?
Yeah. Well, I would say that a focus that we have had at Within Reach, especially since the pandemic, where we have gone completely remote. All of our services are remote at this point. And we have been hiring people as we've had new positions and transitions across the state, and we are very intentional with hiring people from communities that are non-English and they represent BIPOC communities. So I don't actually know what the data is in percentage, but I don't know if you know, but most of our staff is not white.
Yeah.
At this point, and I do think that makes a huge difference. Yeah. So that would be one way. And then we do a lot of targeted marketing through community partners and online as well. But we haven't found the online advertising to be quite as effective actually as the community partnership building. Yeah.
Describe the community partnerships. Give us an example. Like say we're out in a really rural county out in Eastern Washington. What have you been doing?
So I can give you an example that I think is perfect from Central Washington. So in Yakima, the Yakima County area, we have what we call a sub-affiliate partner. We're working with Children's Village and other local community-based organizations in Yakima and Kittitas counties. And they are working locally to spread and support families with Help Me Grow services. A key piece of that is our staff person that lives. We have a staff person that lives in Yakima County, and we have a local number. She answers a 509 local number if people call. So providers like Dr. Thatcher Felt, who is a partner of the Help Me Grow work, and on the Within Reach board now. But he is a partner who has an online referral partnership with us, has materials that he gives out at the Well Child Checks, and they have that local 509 number that our local staff person, bilingual staff person, Karina, from the community answers and spends a lot of time with the families in that area over multiple interactions. And so that's an example that we found to be really successful. Yeah, you're welcome.
We will walk you through who the chapter is if you don't know, and then a little bit about how to be an effective advocate. Our vision, we promote the health and wellness of children, adolescents, and families, and advance equitable, evidence-based, collaborative approaches to pediatric care. We champion the health and well-being of children, adolescents, and families through advocacy, education, and partnership. And our core values are equity, advocacy, and collaboration. And so you see a lot of David and Cynthia reflected here. There's some real intentionality about our word choice: children, adolescents, and families, because we know adolescents are very often forgotten in advocacy and in healthcare, and that families are instrumental in children's lives. We also can only get this really important work done through partnerships and collaboration. So that's some of who we are. We have 1,200 members all across the state, very statewide, and our board is also very statewide. And we have some specialists in our membership, but certainly not enough from here. Our specialty membership from Sacred Heart Children's Hospital is phenomenal, which we're really appreciative about that. And most of our members are general pediatricians in the community, and of course, quite a lot of hospitalists. And we welcome nurse practitioners and have some really great nurse practitioners in our membership, as well as naturopaths. So we'll share with you our goals for the most recent state legislative session, which were, our first set of goals are really in kids' behavioral health. And in the 8 years that I've been working for the chapter, kids' behavioral health has been our members' number one concern, not surprisingly, and continues to be. And so this year we were delighted to work to advocate for the partnership access line, doctor-to-doctor communication between PCPs and psychiatrists, as well as the Washington Mental Health Referral Service, where parents can call, or teens can call, to find a counselor who has some access to help them. And new part of that umbrella program is something called FAST, First Approach Skills Training. And this is really exciting. There are a few psychologists here at Seattle Children's Hospital who have gathered together the evidence-informed interventions for the most common mental health needs kids have. So for anxiety, depression, acting out disorders, and they teach mental health therapists, and some pediatricians even take the courses, time-limited, evidence-informed care, so that we can help kids get better more quickly. We're doing something that works, and we're creating some throughput. And we're not having to have kids engaged in care for a long time that's not helping. The evidence is pretty clear and it's working. So that was one of our priorities, as well as a core priority to improve reimbursement for mental health care for kids who are insured on Apple Health, and to create loan repayment for people who are behavioral health professionals, or grants for people who want to be behavioral health professionals. And then the last agenda item under the behavioral health umbrella was to help children who have developmental disabilities and help their parents when they're having very difficult episodes and are getting stuck in hospitals, to help break that loose, because it's been wholly inappropriate for those kids and families. Our second legislative priority was to raise the age of juvenile court system in our state. It's 8 that kids in our state go to juvenile detention. And it's not
that.
It's
An 8-year-old can be involved in the carceral system in the state of Washington.
It's
I
really,
was shocked and horrified, sorry to
No,
interrupt,
please,
but like,
it's fine.
that is such a crazy, crazy system that we have set up. And everyone in this room who's involved with pediatrics knows developmentally what an 8-year-old brain is like. That does never, ever belong in our jails. And so the fact that that is what we have in our state,
yeah, I feel the way that Lana feels about that. And it is happening. So we did look, the Department of Children and Family was very collaborative with us, and we did look at a 3-year period of time, all the counties across the state. In a 3-year period of time, there are a couple thousand kids between the ages of 8 and 13 who are in juvenile detention in our state. So it's happening, and it's not okay. And our third priority was to get every kid in Washington State free meals at school without any test of need. I'll tell you a little bit about what we did and then what we accomplished. We have a legislative committee that meets once a month, and then during the legislative session meets once a week. And we partner with a lot of other organizations we'll talk about today to hear from our members and other organizations what our priorities should be. And then in the most recent session, we helped pass about 20 bills to improve child and family well-being. Our members testified at 15 hearings, and our members spoke with 40 of the 49 legislative districts in the state many times. In a typical session, we touch legislators between 1,000 and 1,500 times from our members. So what did we accomplish? We got $1.6 million for the mental health referral service and FAST, and then we got a 15% increase in behavioral health rates, a $10 million in loan repayment for health professionals, and $10 million dedicated to behavioral health professionals. We have Last year, we got a pediatric community health worker workforce funded. We got continuation funding for them and now ongoing training for them so they can be successful in their clinics. In terms of school meals, if you have a school building where at least 30% of the kids are on free and reduced lunch, that whole building now gets it. So that's what we got. It's not what we asked for, but it's really meaningful. We'll reach, I think, another 90,000 kids this year. And then raise the age. We did not get raise the age of juvenile detention, so we'll be going back at this again. And in the interim, we'll be really working hard at what do we need to do differently to get there. And so we're really looking forward to that. We have some incredible residents from Seattle Children's Hospital who will be working with us on it, and we're very excited about that. So just to give you some other ideas about what we accomplished with other incredible partners and lead organizations. Really meaningful year in Washington State, I hope you know, on gun safety with an assault weapons ban and required education to have a firearm and extended waiting periods to have a firearm. And the Alliance for Gun Responsibility deserves a lion's share of the credit, but we are a really credible and unusual voice to have pediatricians and PICU docs testifying about the kids they've cared for is very powerful. And so we're strong partners on getting that work done.
Don't forget about grandmothers too.
Well, the grandmothers and the moms have done some fabulous, fabulous work. We also, you'll hear a little bit more today about getting insurance coverage for hearing aids, which is a big breakthrough and has taken years of work. And then we were very present and an important voice in ensuring access to gender-affirming care and reproductive health care. And there's a wonderful bill that was passed that will maybe be challenged in our initiative process this year that you should know about. So that adolescents coming here for gender-affirming care or reproductive health care from other states have shelter when they're here. Our laws were such that we can only shelter those kids for 24 hours, and now our law has been changed. Those kids can have shelter when they come here. And that the State Department of Children, Youth, and Families has some accountability for their well-being. So that it may be challenged on the initiative process this year that those kids have shelter when they come here. So we are already having conversations to try and prevent that from being the case. We have some wonderful adolescent medicine physicians and injury prevention physicians involved in our organization, and we're able to improve some control over THC products. And some wonderful pediatricians helped to get sufficient recess minutes for children in Washington State. So those are some accomplishments we're really excited about. I'll let you know sort of where we're headed. This is what our members have recently told us from across the state about what they think is important for us to address for children in the future. So not surprisingly, access to mental health care, top concern, and then followed by social emotional well-being. So how can we promote the social and emotional well-being of children, knowing now that there's an entire population of children who is having emotional difficulties? Family economic well-being, firearm safety, food insecurity, nutrition, and obesity. And then the last thing in our survey that was pretty highly rated was early relational health, which means, Cynthia would love, affect the bonding that parents and babies need to have and the well-being, both financial and emotional, that parents need to have in order for their infant to bond with their infant and have those attachments will lead toward a life course of health. And it's you all know this, but it's shown to prevent mental health and substance use disorder in adolescents if you have those strong bonds. And then we also convene partners. We've been doing this for about 3 and 4 years, depending on the committee, but we have Champions for Youth, which is an external committee that brings together primary care, school nurses, the Office of Superintendent of Public Instruction, health plans, and we work together to improve child and teen well-being. And then we also have an external committee called First Year Families. Cynthia would like that, I would imagine, which advances the medical home's impact on those early years, attachment and relational health. And here's some examples of who sits on these groups. We have state agencies, parents, behavioral health providers, early childhood experts and providers. And so we surveyed them this year. This is the first year we've surveyed external partners about what we should do. And I'm really glad that we're doing that. And you see some really good alignment. These are the 4 places that our pediatrician members overlap with our community partners and what we should be addressing. The blue line is our members, and the green line is our partners who are not physicians necessarily. Access to mental health care, social emotional well-being, family economic stability, and then early relational health. So I will turn it over to Linda. We'll just keep going back and forth.
Wonderful. So we really took a lot of inspiration from Danette's video from earlier this morning and how beautifully she characterized what Cynthia brings or brought to this work and how it carries through in what we're currently doing today. And so she really talked about cultivating and maintaining relationships. She talked about working with allied organizations that we as healthcare providers cannot and do not do this alone, and working in coalitions. And I don't know how to work this thing. Okay, good. So first and foremost, to talk about cultivating and maintaining relationships. This is no surprise to anyone who's in healthcare. We all do relationships all day long, every day. But this is the key, right? This is both with our obvious allies and with people who come from very different sectors. The idea of developing trusted relationships, interacting with authenticity, becoming trusted messengers for our patients and our families. And I'd want to share a story with you all of one of the times that we, I think very successfully as a chapter, created an ally in our state legislature. And it was, I don't even remember how many years ago, but
Probably
we were
7 or 8.
7 or 8, okay. So we were working on a firearm safety bill. And Sarah came to me, I was chair of the committee at the time, and said, okay, we have this legislator who is not on board with us here. He's a guy from Moses Lake. We don't have anyone from Moses Lake who came to Advocacy Day this year. I don't know how many pediatricians we actually have in Moses Lake, but there weren't a lot to choose from to start with. Lilach, you're the chair. Will you please go and chat with Representative Tom Dent? And Representative Tom Dent, if you all haven't met him, just from across the room, you will know that he is a very different human than I am. He wears a big old cowboy hat. He has a big old metal buckle, and he kind of swaggers in. And he is packing a sidearm, I have learned since, always. And statistically, we as pediatricians are part of the least firearm owning group in our society. So, very different human. And part of the concern around the firearm safety bill that we were promoting that year was that if children had a mental health diagnosis, would that then prevent them from being eligible to own a firearm later on? That therefore we should not screen for certain mental health things because it could prevent their eligibility to be a firearm owner. I don't know if that registers, but that blew my mind that we would prioritize future Second Amendment ownership over current mental health challenges. But that was part of the concern. And so I sat down with Representative Dent and we started talking, and through the course of that conversation, it came out that he had adopted a child out of the foster care system. This child was now a young adult who had struggles with mental health. And we were able to completely shift that conversation to his concern as a dad for the young man who was in his home, my ability to empathize with that as a pediatric provider who had worked with many families with similar sorts of concerns. And I honestly don't think in the end he voted with us on this particular firearm thing, but we developed a connection and we developed a trusted relationship and respect that even though we could disagree, we had some shared interest in mind. Representative Dent has become one of our strongest allies on mental health work in the state legislature. He has my number on his cell phone. He has called me on a Saturday morning once and said, okay, Lilach, this bill's coming up. What do the docs think about it? He knows I don't agree with him on lots of things, but we have developed a relationship so that we can work together on the things that we are in alignment with. And I argue with them about a bunch of different other stuff, but we have that respect and that relationship there, and that is the foundation that we all can build with our legislators to really advance the needs of our kids, because that 9 times out of 10 can be common ground, even with everything else perhaps being different. And I think, Sarah, you
I'll
have a
just
story you
share-
wanted to share as well.
Yeah, it's not as good of a story, but it just about agency leaders and maintaining the relationships with agency leaders. The head of our Medicaid agency came to our state about 5 years ago, and we rapidly engaged her and had her give talks to our members and come to meetings that we had. And she's very passionate about social determinants of health, which is one of our top priorities. But really, at the end of the day, I'm somewhat cynical about what our Medicaid agency often focuses on, which is the more expensive, costly, grown-up patients who are getting old or have substance use disorder along with their medical needs and are costing the state a lot of money. That's what our Medicaid agency tends to focus their time on. They don't need to, but we're over here saying kids to prevent those sick adults later. So I sometimes get a little bit bitter about their focus. When the state applies to the feds for a waiver, it's about helping people who are leaving incarceration. It's about getting food to elderly people. Where are the kids? So that's sort of some of how I feel. But I try and stay engaged with this state agency leader. And on my cell phone, when I see a 360 number come up, I just answer. That's Olympia. And so I was working and I saw 360 and I picked up, and it was the state Medicaid agency director. Well, she has my number. Sarah, I'm giving a talk about kids and I want you to tell me what to say. That's a nice place to be. This is sort of last August or September, and I thought, I should stop being so cynical about her. And she has led the way. Sue Birch is this woman's name. She's a nurse by training. She led the way for 0 to 6 continuous coverage on Medicaid in our state. So the feds are in the process of approving it. The kids age 0 to 6 are going to have Medicaid continuously, period, no breaks, they're covered. And I was looking at her bio this morning, preparing to see you. Guess what's listed in the second paragraph of her bio? She's leading the state in Washington for 0 to 6 coverage continuously for kids. So it's important to keep these partnerships, even when we're weary and feeling like nobody's listening about the kids. She's really making a phenomenal difference for, ultimately hundreds of thousands of kids by that move. So that's my story about Sue. And then we'll just talk about allied organizations. I mentioned the Alliance for Gun Responsibility is how we get such good gun safety work done in this state. If you don't know about them, they're highly, highly strategic, very strategic. And then the ACLU is our partner in raising the age for juvenile detention, as is the King County Public Defender's Office. And then we have some agencies we work with on economic well-being. And then I will let Lilac take over, just giving an intro to why we're going to watch this video.
Yeah, so this is this video is going to share a really exciting legislative win that we had this year. Several years ago, I think 6 or 7, we began to work on the idea of hearing aid coverage for children. Children who are not able to hear, as you can imagine, have lots of challenges socially, developmentally, in the school setting. Hearing aids are expensive, and as kids grow and their ear molds need to be changed, it's not like for an adult-sized individual where you can get a hearing aid and it'll probably fit you for a long period of time. This isn't the case for kids, and then also kids do silly things like take them out and the dog chews them up, right? So the idea of the equipment and the cost of that equipment is a whole different ballgame for young people. And up until very, very recently, because this was a legislative win this year, hearing aids were not covered by Medicaid. And part of the partnership and the allegiances that we have been able to make at the chapter are not only with outside agencies, but also with families and with young people. So we want to share with you a really, for me, very touching video of a young person that we helped get involved and empower.
and I'm a third grader at the Evergreen School. I am honored to be here today and to support House Bill 1222. I want to stand up for the right for everyone to be able to afford hearing devices. When I grow up, I want to be an engineer, and I will design a suit that will allow me and you to fly. Or maybe I'll be a rock star. Or maybe I'll go to law school so I can fight for the rights of people like we are today. Or maybe I will represent my community as policymaker. Or maybe I will be president. I have severe hearing loss. I might not ever dream to be any of these things without my hearing aids. My hearing aids allow me to hear, participate, learn, and to communicate so I can work with my family, classmates, and community. Because of my hearing aids, I am able to be in a highly capable school program and dream big dreams. I would not even be sitting here before you today, showing my family and friends and my excited classmate what it means to be excited to be part of the law-making process without my hearing aids. Everyone deserves the right to have hearing devices, not just family who can afford them. Please vote for this bill. It is the right thing to do and the moral thing to do. And my mom says I have to tell you that it makes good fiscal sense. Martin Luther
I think
King
you're already
Jr.
a rock
said,
star, Zephyr.
You're already a rock star.
Martin Luther King Jr. said, "Believe in yourself. Always feel that you count. Always feel that you have worth. Be a bush if you can't be a tree. If you can't be a highway, just be a trail. If you can't be the sun, be a star. For it isn't by the size that you win or fail. Be the best of whatever you are." For 5 years, we have been fighting for this bill, and this year, I think all of us can do it. I'm only 9 years old, but today I know that you can hear me. Please vote for this bill so our community can hear you and stand up for all of us. Thank you.
Thank you.
We are very, very excited to not only be involving you all as our pediatrician community, but also families and young people in this process. Because that's what we're all about, right? So,
And I will say, you all probably know this, but stories make policy, not data. We're all really good at data, and I keep having to stop myself from using it. It's stories that make policy. Leilak and I worked for years to try and get Medicaid, Medicare parity for pediatric care. And the year we got it because of a story. And the story was twin preemies who lived in Olympia, and their mom had a 2-year-old. And no provider in Olympia would take them because they were on Medicaid. So mom would take her twin preemies and her 2-year-old to Tacoma for her care. Well, that's a long way when you have to go to the doctor that often. And so we had their permission, and we had, these kids are cute, and we had their pictures, and then we had a legislator who took that piece of paper with those kids' faces on it, and she taped it to every door of the legislature. Because she's allowed to do that, legislators can, we can't do that. And I think we got Medicaid, Medicare parity that year because of those kids, not because of any data I can tell you about access to care and delayed care. So,
and we use them both, right? Like no data without a story, no story without a data. We have to use them in conjunction, but we tend to be really good at the data part, and we have all the stories. We all see them multiple times a day, and it's a matter of realizing their power and using them to make the changes that we want to see made.
Yeah, absolutely. So here's some examples. We talked about my favorite coalition, HICCY, the Health Coalition for Children and Youth that Cynthia helped form. This is still one of our most important coalitions we have for child health, as is the Prevention Alliance. For several years now, there's been a behavioral health work group dedicated to kids' needs that's legislated, and that's been really instrumental. It's led by Representative Lisa Callan, who's a highly effective leader, and we have a lot of representation there. And then we also are part of a lot of other coalitions, and it is you all know this probably from working here, what you care about, but this is a very special state and very special community, how well folks work together and what we can get done in concert with each other. And I think I'm gonna turn it over to you.
All right. So to talk more about advocacy and the role that everyone in this room can play to get things done for our kids, and this might be very, very obvious, but it probably didn't take any of you much time out of medical school to realize that the short amount of time that you saw your patient every day was minuscule in terms of its impact on their health and well-being compared to everything else and everywhere else that your patient was traveling. So whether it be the school or lack of school, whether it be the housing or lack of housing, the food or the lack of food, all of the other things that we now have a label of social determinants of health, which once upon a time we didn't use that phrase, those things have such a greater impact in the well-being that the children that we see every day get to experience. And so even though that was probably not very largely emphasized in our medical school training, it becomes really obvious that that's the field that we need to play on. And so stories that we encounter every day of what our patients and their families are doing, as we just said, those are the things that make policy. And I think it is really important for us to remember that we hear and see those stories every day, multiple times a day. The lawmakers in Olympia do not. The things that are really common to us could happen on the moon for as much as they know. Like, it is not their world, it's not their reality, and that we have something very unique and special to bring with the stories that for us are very commonplace. We are credible. There are so many physicians who come to, you reflected this in your comments. What am I doing here? I don't know what this place is. I don't know how lobbying and policy making happens. It doesn't matter. You have such credibility. You have such expertise. And the folks who are making our policies and our laws, honestly, are trying to be experts in a bazillion different things. There's no way in the world they can do it, and they can do it all well. They cannot know environmental policy and infrastructure and legal and medical and education and everything else they need to know well. And they love having someone who has that expertise come in and tell them, this is what I'm seeing, this is what we think you should be doing. It is a relief to them, and we are such credible messengers in their eyes. And the skill set you need is not any different than what you use every day with your patients. Everyone in this room is experienced with sitting opposite a caregiver who maybe doesn't quite have the same idea of what should be happening with the patient in front of you. And you have that skill set of building the bridge, making it very clear to that caregiver that you both are working towards the same goal. You both want what's best for the young person who's in front of you. You may disagree about certain things, but your goal is the same. And then working collaboratively to get there, that shared decision-making process. This is the exact same thing. It is completely transferable to the policy world. And so this is nothing new. This is nothing that you cannot do. This is something that you do in your sleep. And what also happens when everyone gets involved is that we do have this powerful strength in numbers. Every story is its own little data point, but when you have 1,200 members of pediatricians from all over the state, from all sorts of different areas and all sorts of practices, that becomes very significant and powerful. So, things to think about, because hopefully you'll leave here being super inspired to actually get involved and do this kind of work, is how do you craft your message? You want something that's going to be easily understood. We in medicine, as you all know, kind of speak a different language, and we're all very accustomed to translating that language when we speak with the families in our practices, so we can easily get into jargon and little catchphrases with each other. So remember that you're talking to someone who doesn't know this world. And you want to convince folks that this issue actually means something to them. And again, children are such a common ground. Most folks that you're going to meet have been a parent or a grandparent or an aunt or an uncle. Heck, they were all children at least at some point, right? Like there's something there that's common. And so finding that place where it is something that they can care about as well. You want your message to be relatable and actionable. Personal stories we've talked about. And it's also really good to come with some ideas, because no one really likes people who are just kind of whining and complaining. And it doesn't mean that you have to know the solution on your own. That's, again, where the power of numbers and the power of our organization comes in. But I think we really pride ourselves as a chapter of being able to do some research ahead of time, being able to not always reinvent the wheel, but seeing, for example, the mental health referral line. I don't remember what East Coast state it was where we modeled that after.
Massachusetts.
Massachusetts, thank you. But we said, okay, there's someplace else that's doing something that is similar. They've seen a similar problem. What can we learn from them? What can we take and mold to our own needs? Because obviously Washington is its own place, and we brought a bunch of stakeholders to the table, families and practitioners. What do we need here? But the idea of coming with some solution as opposed to just complaining is definitely beneficial. All right. This is probably just super obvious for all of you. The idea of being able to be logical in your thinking as you're wanting to present your case to a legislator or a policymaker, talking about defining the problem, talking about defining the solution, and then asking for support. So when you go into a meeting with the legislator, it's really important to courageously make the ask. It's one thing to say, this is the story, this is the need, but then you have to kind of close the deal and say, okay, this is, will you sponsor this legislation? Will you vote for this? Can we count on you to bring this up in committee? Whatever the particular ask is, closing the deal sometimes isn't as natural as telling the story, and so it is really important to do that. And if you don't have that person's support, figure out what it is that they need. And that is sometimes easier and harder because sometimes they won't necessarily share that with you. I will tell you my own personal frustrating thing that I am working on right now, the federal assault weapons ban. Our dear Senator Maria Cantwell is the only senator in a state that has a state-level assault weapon ban who has not signed on to the federal assault weapons ban. So there are 10 states in our country that have banned assault weapons. 19 of those 20 senators have signed on to the federal ban. Maria Cantwell has not. For the life of me, she will not tell me what she needs to get onto that. So you all can help with that if you want to bug her. So sometimes it is going back again and again. We've talked with her staff and, oh, we're putting together a report for her. Okay, what do you need for that report? And dig and dig and dig. And I am certain at some point we will get Senator Cantwell on board. But that can be a tough one. Even though it's a tough one, we're keeping the conversation open. And I think that is also really important, as you've heard alluded to by other folks today. The person who may not be on board with you today might be your biggest ally with the next issue or the next year. And being a resource for the future. And always thank them. I mean, I think most pediatricians are pretty good at this, but the whole idea of be kind, and that can go a long way.
I'll add a couple of thoughts here, Leila. We've started to encourage our members when they meet with legislators to say, really just say the words, you all are very humble people, and you need to be a little less humble. So say, I want to be a resource for you. I'm going to give you my number. So when you have questions about healthcare, if you have questions about kids, you can give me a call. Because that's what you want. You want that 360 number they're calling me, you know? So that's the place you want to be, and you actually don't know when you'll have that breakthrough. We do our advocacy day, we have about 100 people come to Olympia, it's a lot of fun, and we had to do it on Zoom for 2 years. And so our poor staff had to figure out how to create 100 Zoom rooms, right, that everyone could go to meet with their legislator. And if someone ended up in the Zoom room, if a legislator ended up in the Zoom room without a pediatrician, then I would get a text, Sarah, you gotta go to this Zoom room. So I showed up in a Zoom room with a legislator I didn't know, from Tacoma. He's a firefighter. And he, of course, shared our mental health advocacy agenda. He was on board, wanted to support it. And that year we were trying to get an increased vape tax, commensurate with cigarette tax, because guess what? Kids don't have money. So a high tax prevents kids from vaping. And he was not on board with that. He was all about the small business owner, the little guy, and this would decrease the business owner's revenue. We had an increased vape tax. And I shared with him how addictive it is, about the adolescent brain, and what was happening to kids. And this is a gateway to a lifelong addiction and health problems. And we couldn't come to agreement. We just couldn't. So I thought, well, at least we've got him on our mental health agenda. And I moved on. So within the month, he met with one of our members who was his constituent. She actually made it to the Zoom room, and they met. And he had changed his position on the vape tax. He came to change his mind. So it can work. It can happen. And I was so delighted that, I debriefed with my member. I said, how did your meeting go with your legislator? And she said, oh, it was so great. He was just really supportive of that vape tax. I just about fell out of my chair. So it can work, and you just never know when you're going to have a breakthrough. That was a pretty quick breakthrough, but you can get there. You can get there. So I think this is just an example of how you can ask, tell a story and ask for what you need. So here's an example of how you can say this to a legislator. Today, families are facing even bigger problems and barriers to meeting their children's needs. And kids' mental health needs have spiraled to epic proportions. And families need help getting the social and financial services they need, and they need help navigating our healthcare system. Here's a couple stories that you could use from your practice that are on the face of it a mental health need, and as you dig deeper, there's a different problem. There's a social and financial problem. So I learned from one of our members about a mother of a 3-year-old and an infant who our member thought had postpartum depression, and that she needed to help her with the postpartum depression. In fact, when you peel the layers away a little bit, she had really not an adequate housing situation. And when her housing needs were met, she did not have a mental health need. And this second story points to the importance of having someone who can really understand a patient's needs. A 14-year-old presented at a primary care clinic that happened to have mental health care on site. And the 14-year-old was pretty convinced she had an eating disorder. And as you know, eating disorders have really grown during lockdown. They really grew quite a lot. And so waits for eating disorder care at the time that this child presented for help were months and months. And the community health worker that worked with her started to better understand her problem. And thankfully, this 14-year-old didn't have an eating disorder at all. Her mom worked nights. And the 14-year-old was anxious about her mom being away from home at night and worried about her mom's safety coming home at night. And so treating a kid with anxiety is so much easier than waiting to get a kid into services for eating disorders. So the ask for our legislature last session was to educate them that non-licensed staff, such as community health workers, have cultural expertise, linguistic expertise. They better match the patients and families we serve. And they are knowledgeable about community resources, and families can reach them. They can text them, they can call them on the phone, they don't have to deal with the phone tree. So we asked our legislature last year to fund community health workers to help children, teens, and families with financial needs and mental health needs. So this is just an example of how quickly you can convey what a need is and what a solution is.
So we're going to do another example here. This is Elizabeth Mead, who is she our past president right now? No, she's
No,
no longer.
well, her term ends July 1. She's
Yes.
still our past president.
She's officially our past president for another couple weeks. Elizabeth is Swedish, and this is a short video that she shot, which was an example of an interaction and an ask that one might have with the legislator. So.
10% of our patients last year were admitted for mental health reasons, so mostly kids that were suicidal or wanted to hurt someone else. This is not acceptable. These kids are coming in waiting for a bed, sometimes waiting for up to a week or more just to get psychiatric treatment. And what we know is that the vast majority of these kids, if they had access to robust outpatient services, would never end up in the hospital and never be at the point where they're wanting to take their own life. I had a 15-year-old patient a few months ago who had been asking for counseling for 6 months, and her family was unable to find anybody that would see her because she had Medicaid. This is a girl who ended up with a very, very serious suicide attempt and nearly died because she was not able to get outpatient treatment. This is something our chapter knows is extremely important. It's not acceptable for the kids in our state to be suffering like this, and we're hoping to change that.
So real quick, she stated the problem, she gave an example case, she ended up with an ask, less than a minute-long video. So you don't have to prepare a doctoral thesis or a super long interaction. You can be short and sweet to the point and communicate really effectively. Hopefully, if you are not already a member, hearing about some of the things the chapter is doing might inspire you to join us on this journey. We have Advocacy Day every year, which is now back in person, thankfully. But we would certainly welcome anyone to be involved and actually have that face-to-face interaction with our policymakers. If you're interested in adding meetings to your life, the Legislative Committee would love to have your participation. And we even have an app that you can download where you can get pinged by the chapter whenever anything is going on advocacy-wise that is coming up for, this committee is going to hear whatever bill this week. Please reach out to your legislator because they are on the committee and we want their support. Or this is coming to the House floor for a vote. Please reach out to your person because everyone's going to be voting on this. It is a really pretty easy way to stay in touch and to be one of those 1,500 or so contacts that Sarah mentioned. And they really do count. I mean, even if you have someone who's in favor of everything child positive that you would think about, when they go to their colleagues, they can say, hey, I got 100 emails on this and 89 of them were in favor. Aren't your constituents also feeling this way? It provides them with ammunition that helps them, if they're having to take a difficult or courageous vote, to actually know that they have the support of their constituents. And then if you want to donate to the chapter, that'll happen. That helps too. We're now a 501c3.
We've been a 501c3 now for I think 4 or 5 years.
Yeah.
And I'll just share in terms of membership, don't assume you're a member. So the way things work at Seattle Children's Hospital, it may be that there's a staff person who's renewing your AAP membership nationally. That doesn't necessarily mean you're a member of the chapter. So definitely want to look at it and see if you're a member of the chapter. It's cheap, $190 a year. We use your money very, very well, I promise. And what else do I want to add? We're happy to take any questions you have and anything at all, now or at another time as well. I know it's the end of the day.
Yeah, Sterling.
2 things, and they're different in terms of different routes to success. I worked in Canada for 15 years and did a lot of work with the legislature, both provincial and federal level there. And they teach what they call knowledge translation to people like us when we go there. And one of the things they taught a lot was, how is whatever it is you're saying going to help this guy get reelected?
Mm-hmm.
And I haven't heard that tack taken much here. And I wonder if you think about it that way.
It's really interesting.
I would say it hasn't been the primary framing that we have used.
It's been a long day, and thank you all for hanging out. We've looked backwards, and we've looked forward in celebrating Cynthia and David. And now we will look to tomorrow, because our last fellow, Kevin Dunn, is coming to us from Melbourne, Australia, and it's tomorrow morning. Kevin came to us in 1984 to be a fellow in our program. He stayed with us till 1986 when he decided to return to Melbourne, and he took with him my secretary, Betsy Brown, as his wife. Betsy and Kevin have been married ever since. They have 3 children now, 35, 33, and 30. Kevin went back and joined the faculty at the Royal Children's Hospital, where he worked part-time and spent the rest of his time in private practice doing developmental disabilities at the Werribee Mercy Hospital, except for a period from 2012 to 2017, when he was the clinical director of the Department of Rehabilitation at the Royal Children's Hospital. His research has been primarily in the area of I'm sorry, my voice is just disappearing. Issues of concussions. And he is now either completely retired or nearing retirement. At any rate, it's the end of our day. I bring you Kevin Dunn in Melbourne, Australia, and tomorrow.
Thank you for the opportunity. I'll be mainly talking about my relationship with David and Cynthia. So currently I work half-time in the Department of Rehabilitation at the Royal Children's Hospital in Melbourne, and also as a research associate with the Murdoch Children's Research Institute. And the area of interest at the moment is more children's concussion. So how did a recently graduated Australian paediatrician end up being a fellow in the Department of Congenital Defects at the then Children's Hospital and Medical Centre in Seattle? A few years beforehand, the head of orthopaedics at the Royal Children's, Malcolm Menelaus, who sadly passed away in 2000, developed a professional relationship with David. Malcolm had researched and written extensively in the orthopaedic management of children with spina bifida, and he was open to evaluating the success or failure of his surgical procedures and also the natural history of the condition. The patient data management system developed by David, which used computers, mainly mainframe computers then, enabled progress and outcomes to be tracked over time. It was this connection with Malcolm Menelaus as to why the fellowship was offered. My first visit to Seattle in September 1983, the sun was shining, Mount Rainier was glistening in the background, the Olympics were glistening away, and there was Puget Sound. The department were friendly and welcoming, and there was a sense of dynamism. David and Cynthia invited me to stay at their home. Seattle at that stage was, or still is, a dynamic place, both medically and also with the emerging tech industry. There was no second thought on my part when the fellowship was offered. So professionally, what did I achieve? Again, from my exposure to David, Sterling, Jeff McLaughlin, Pat Hayden, and others. First of all, the clinical experience. The Department of Congenital Defects offered a quality, comprehensive program with a large variety of health professionals that met professionally after clinics. And that sort of didn't happen back in Australia in Melbourne. We tended to do isolated clinics. Additionally, he supported my interest in rehabilitation by linking me to the Paediatric Rehab Service and also the University of Washington Department of Rehab. He actively encouraged research and insisted that I enroll in a master's degree to upskill my statistics so I could do research. And from him, I also learned to nurture young paediatricians and allied health professionals, where he took a personal interest in them personally, their personal situations and their career development. When I reflect back, what David was doing was what we now know as evidence-based medicine, which wasn't a buzzword at that time. He realised that paper-based systems were inaccurate, and he used computers and standard ways of collecting data to track medical information. I will quote from his book, which I think outlines this better. So the book was The Myelodysplasias and Extrophies. So I quote, "Just as teams within centres were developed to assure comprehensive treatment for children with myelomeningocele and other forms of myelodysplasia, so now we must form larger collective collaborative networks of centres to describe the natural history of individual deformities and the best methods of management. The computer age has given us the tools to analyse large data sets until we can establish such a network and develop recommendations based around sound statistical analysis." I'll also quote from Malcolm Menelaus's book, The Orthopaedic Management of Spina Bifida Cystica, the 1998 edition. And he was referring to David, and his quote was, "Our studies on the natural history of deformity and the influence of surgery and similar studies have relied upon Professor David Shurtleff at the Children's Hospital in Seattle. He developed a computer database called the Patient Management System, from which all our studies over the past 10 years have been based. David has improved the study of these children throughout the world by the development of the International Myelodysplasia Study Group." So my apologies if you've already gone over that ground. I was only being here for the afternoon session. So did he achieve that goal? The emphatic answer is yes. Professionally, I've continued to work in the area of developmental disabilities through my career, and more recently in the Department of Rehabilitation at the Royal Children's. Some personal reflections. David and Cynthia were very kind people who were open and inclusive. They invited me into their home from the beginning. They invited me to their holiday place at Dabob Bay. They invited me on numerous fishing trips. David and Cynthia worked as a team, supporting each other's professional endeavours. David was interested personally in colleagues and also in junior medical staff and their career development. David had a wide range of professional networks. In my situation, more with the Spina Bifida Association of America. I was amazed. It was both professional colleagues, but also he had interest in families of children with disabilities such as spina bifida, and also with a number of adults, and he would often meet with them, stay in their homes, etc. One crucial key performance indicator of the fellowship was to learn how to fish. They took me on many fishing trips. However, despite their best efforts, I failed that KPI and did not catch one fish. If we have enough time, I will give some personal anecdotes. David does not wear ties. At the American Academy of Cerebral Palsy and Developmental meeting in Boston, this is around 1986 or 87 or something, he invited the team to an old upmarket restaurant that he and Cynthia used to aspire to go to when they were young, penniless students living in Boston. It had a dress requirement code of a coat and tie. David skirted around that requirement with a t-shirt with a printed tie, gave a big smile and was admitted. Along the same vein, when David and Cynthia visited Australia in May 1989 where he presented at the Australian College of Paediatrics meeting in Adelaide, we were invited to dinner by the Governor of South Australia at Government House. The state governor in Australia is the representative and appointed by the King of England. All pomp and ceremony, nothing like what a state governor is in the USA. The invitation specified formal dress attire. Think of a dinner scene in the English period dramas such as Downton Abbey. David arrives again, Pollinac sweater and a coat, but as he was the guest of honour, he was admitted. Finally, as Sterling alluded to, David, in this situation, Hillary, were instrumental in me meeting my wife, Betsy. Betsy was employed as a secretary in the department. I got to know her more when David was writing his book. Hillary was his editor and Betsy was a typist editor. Hillary and I shared an office. Betsy was a frequent visitor and our relationship developed from there. Thank you, David. I've enjoyed the experience. We last saw you in May of 2019, and I've not been able to visit the States because of COVID restrictions, but I plan to be there in August. I hope to meet up with you then, and thanks for the experience.
A couple of comments just for the for the group. I want to thank everybody who was here, everybody who came in and attended virtually for every part of the day that they could. With Kevin's being successfully broadcast, we can now say we had an international meeting in honor of the Shurtleffs. I certainly want to thank the Shurtleff family for coming today. I hope that you're better able to see the impact that David and Cynthia had on all of us in so many ways, on us and our organizations. It also, I think it's important for some of us who've worked in the medical field to recognize how important the work of David and Cynthia has been in our communities at large, and not just within a treatment room or an office setting. Organizations like within REACH, Hear Me, Help Me Grow, the Washington chapter of the American Academy, really deal with issues that sometimes get lost in the medical hustle and bustle. I particularly want to thank the Washington chapter because they were incredibly helpful in getting the word out about this. They put notes about it in their newsletter. They were very gracious in terms of content. I want to thank all the speakers for coming today. It was a chance for me to put some names with faces and to meet some old friends and see folks that I haven't certainly seen in a while. I want to thank Dr. Doherty, the Division of Developmental Medicine and CYASHCN for the audiovisual support, the food, the room, your experiences with security, and all of the time that you've been here today. So on behalf of Dr. Clarence, Dr. McLaughlin, and myself, we thank you very much for coming and attending, and happy Father's Day.